Telecystoscopy. Use of remote video technology for bedside flexible cystoscopy. Our objective with this proof of concept study is to demonstrate a novel system for performance of bedside cystoscopy remotely. Additionally, we aim to improve resident training during these procedures with real-time feedback. In the William Beaumont Hospital Urology Staff Clinic, 4 bedside flexible cystoscopic procedures were performed. Indications for cystoscopy included as part of hematuria workup, surveillance cystoscopy for history of urothelial cancer, and as part of evaluation for worsening lower urinary tract symptoms in high-risk patients. Quintry software is the interface utilized for performance of remote cystoscopy. Initially developed for otolaryngology, we have adapted this technology for its use in bedside flexible cystoscopy remotely. Procedures are performed with the provider at the patient's bedside and the expert logged on remotely through the Quintry interface, watching the procedure in real time. Experts have the ability to communicate back and forth with both the provider and patient, as well as save photos and document notes within each encounter. The provider first initiates the session with an invitation then sent to the expert logged on in a remote location. The expert monitors in real time as the provider completes a cystoscopy. In our clinic, procedures were performed by first discussing the use of remote technology with the patient. The attending then went to a remote office to assume the expert role, while the resident remained at the bedside to complete the procedure as the provider. Here we demonstrate video of one of the cystoscopies being performed remotely. Throughout the procedure, the expert, in the right-hand corner of the screen, communicates with the provider performing the procedure at the bedside. He's able to direct the provider to areas of concern, such as the tumor identified during this procedure. He then has the ability to take photographs of the procedure, which can be accessed at a later date or uploaded to the electronic medical record. Here we show additional photos taken intra-procedurally by the expert in a remote location. These pictures demonstrate the ability to use narrowband imaging during these procedures as well. This is a screenshot demonstrating the overread documentation for the encounter wherein the expert has the ability to take notes as well as photographs that can be accessed at any time through the encounter saved in the software. All procedures were completed remotely with no adverse events. Though not formally measured during this proof of concept study, initial reviews by patients, providers, and experts all indicated positive results in terms of satisfaction and comfort with the new technology. Limitations of our proof of concept project include small sample size. Future applications for this technology include use for improved resident training in the performance of bedside cystoscopic procedures, mid-level provider use in performance of diagnostic cystoscopy, as well as difficult catheter placement, emergency room physician use for difficult catheter placement, and finally, use in rural locations where urologist is not readily accessible. Next steps for study of remote cystoscopy will include prospective data collection comparing standard bedside flexible cystoscopy to remote cystoscopy model to demonstrate non-inferiority. Thank you.